There we go. Welcome back, everyone, to the Manifesting Health series. I'm so excited to have with us today Rebecca Dabbs. She is a Master's of Public Health along with a project management specialist for Movember Prostate Cancer Implementation Director for the United States. So we're very excited to have you join us, Rebecca.
Thank you, Curry. Nice to be here.
Excellent. So as we get started, let's talk a little bit about what you do and how you ended up in the space within men's health and men's health advocacy. So tell us a little bit about what you do at Movember.com and tell us a little bit about more how this journey took you there.
Yeah, absolutely. Like you said, I'm the implementation director for Movember here in the United States, primarily focused on their cancer programming. And I work with our global team to implement critical cancer initiatives here in the US market. And Movember is a global men's health nonprofit really focusing on creating positive change so that men can live healthier, longer lives. So my focus primarily is in the prostate cancer, testicular cancer. Right now in the US, we have work in sexual health, survivorship, and equitable access to high quality care for our diverse population here in the States. But prior to Movember, I led community health and population health initiatives with organizations, most recently the American Cancer Society, implementing quality improvement strategies with health systems, health plans to increase cancer screening rates. I did also some statewide efforts here in California to address the decline in screenings following COVID-19. And I did some lung cancer screening access to try to increase the rates of screening for eligible population. So much of my career has been dedicated to increasing access to care for underserved community. And I think it informs my work here today to bridge the gaps in prostate cancer care and lean into the importance of survivorship and quality of life following prostate cancer diagnosis.
Thank you so much. I really appreciate all the work that you're doing because I've read about some of your work, and you and I have had conversations before about how you're helping move the needle in a way that's meaningful. But at the same time, it's it's refreshing to hear more and more groups that are trying to advocate for that gap. And as our listeners are thinking about this topic, can we talk a little bit more about that gap itself? I mean, men routinely do not seek care at the same rates. They do not take control of their health care in the same rates. We have poorer outcomes, worsening outcomes overall, and have, shorter lifespans. And so tell us about some of those gaps specifically within the men's health space that you're seeing within your organization that are such the barrier.
Well, like you said, Curry, help-seeking behavior in men is not anywhere near what it is for women. And if they do seek help, clinicians and healthcare communities aren't properly prepared for what that is and how that looks like. Some of our research in this space brought in some lived experience to kind of inform our work. And there was this wonderful quote that a gentleman put out there, and I just cannot forget it. He said, I don't show up the same way as a woman does. So I don't seem to need help, but I do. I do. So
Why
that
do you
really
think that is? Why do you think that is that men just do not embrace it in the same way?
I'm not quite sure. I don't know if it is issues around masculinities
Hmm,
or identity, feeling vulnerable,
that's a
feeling
good point. Yeah.
fragile. And one of the things that we do here at Movember outside of prostate cancer and testicular cancer is we have recently shifted our ways of working and our strategies here. And now we're all under what we call Movember's Institute of Men's Health. And it is a way to bring in the research and evidence to support our work in that space so we can answer the questions like why aren't men seeking help? Why is it hard for them to ask for help? And one of our number one strategic priorities is lifting the profile of men's health so that we can say, this is what the data tells us. Now let's invest more into the why. So the why, it's very complicated and there are so many factors to consider, but I'm super proud to be part of an organization that wants to invest time, resources, and advocacy to ask that why, not just in the States, but across the globe.
So you talked about was it the Men's Health Institute? Is that the part of the organization initiative that
Yeah,
you have?
so like when Movember, a little history about Movember is it started in 2003 in Australia between these two pals, Luke and Travis, and they wanted to raise money for men's health and suicide prevention. And they thought, hey, mustaches aren't around anymore. Let's grow mustaches and raise money for men's
And they're
health.
coming back a little, but yeah.
I know, right? And we love it. You better believe we love it. So, it started 2003 in Australia. It's grown. We've expanded from our humble beginnings to be in the US, in Canada, the UK, Ireland, New Zealand, and parts of Europe as well. And we've invested hundreds of millions of dollars in our legacy programs, which is prostate cancer, testicular cancer, and mental health and suicide prevention for men, all men's health focus. Um, and we've also funded over 1,300 men's health projects. So pretty great for humble beginnings, but now we see that there needs to be a shift because although that work is foundational and it's much needed, we realize we need to show up differently externally if we want to truly make an impact in the way that people see men, the way that people treat men in the clinical sense, and how we engage with governments and policymakers so that they can work on enacting real change to better the lives of men. Again, we want to create a positive change so that men could live longer, healthier lives.
You're talking about the international roots of the organization, and
Yeah.
it is impressive since 2003,
Yeah.
even just slightly over 20 years, where you are now with your initiatives and your projects and your and the funding and so forth. So this is certainly commendable. Can you tell us a little bit about what differences do you see beyond just the United States, but in general for men's health when it comes to different areas of the world? And it may not be in specific numbers, is not what I'm looking for. Just in general, where do
Yeah.
you see the differences and how do you see men taking on their healthcare initiatives differently in different parts of the world?
Yeah, I mean, that's a big question. It's like a very broad question, and I'm going to try to answer it to the best of my ability. What I do know is that there's a lot of amazing advocacy work and organizations out there who are focused on men's health, but it's a little bit fragmented. They're not We're always working together. The government and the policymakers, the legislators are not always listening to the needs. And that's where we want to step in. And we want to be that convener to pull people together who are in the men's health organization to collectively approach this work. I think I spoke about it previously with you, how we look at things as a collective approach, a collective impact,
Right,
because that's
right.
where the big change happens. So what's happening here in the United States is not unfamiliar to our
Mm.
other markets. And one thing that we have done with other markets, which we will be doing here in the United States for the first time, is Movember puts out what they call the Movember's Real Faces of Men's Health Report. And what that does, it highlights the lived experience of men in their market. So Australia, the UK, Canada, New Zealand, and in at the end of this year, we're going to have our first in the United States. And we're looking not just at the physical health, but also the mental health and societal health challenges that men face And sharing those real world stories and the data, we hope and our aim is to shine a light on those gaps and the importance of this work to address some of those disparities that men often face, not seeking help, not having a healthcare community that knows how to properly treat them. So that is coming out October, the end of this year. We're very excited about it. We're hope that it gets people pumped about the importance of, when you have a healthy man, you have a healthy family, you have a healthy community, and just a healthier world overall.
So I'm glad you mentioned that because I'll go ahead and book you now. After that report comes out, we're going to do this again and talk about some of the specifics so we can dive deeper into some of those gaps. And you brought up a couple of really good topics in here, specifically about collaboration. And when
Yeah.
you approach, whenever you and I started collaborating about this,
Yeah.
our both of our eyes got excited with this. It was all about the different ways. How can we make this bigger, better, and for everybody and everybody involved? And so for our listeners, AAMN has been around for over 50 years. And so for so many years, we focused on the diversification of the workforce. And over the
Mhm.
last, decade or fewer, we've really started focusing more and more and more on men's health specific issues with our Men's Health Alliance that we've started, and now our collaboration with American Nursing Association and all the different other organizations such as Alzheimer's and other groups, and yourself at Movember, how we've started collaborating more and more in a way that's meaningful to get that word out. But not only just get the word out, how can we share this data? What can we do with this data? So it's very refreshing to hear what you're saying. We've done this with VITAS and other groups. To hear what you're saying with this report comes out in the fall is
Yeah.
highlight that and get that word out to all of our members, our collaborative members, our other groups that we're part of in a meaningful way where we can build our strategic plan to address some of these initiatives, to address some of these gaps, and to look at ways that we can expand some of our offerings in a meaningful way. So we're very excited about that. But I'll go ahead and I'm gonna book you for the fall so we can do this over again. So I'm excited. Uh,
Can I just add that
Absolutely.
I love that approach and that recognition of, like, in order to do this right and in order to truly make a lasting, sustainable impact, we have to support each other. We have to support our other amazing champions who are doing this work too and lift them up just as we ask them to lift us up, because together we can really change the face of men's health.
Yeah, and we're looking so forward to all these initiatives. And can we move that needle away from a 7-year disparity in mortality rates when
Mhm.
it comes to men who
Absolutely.
live such a shorter lifespan and have such more aggressive forms of health disparities because of the lack of preventative care or lack of primary care, whatever it might be, but
Yeah.
also high risk behaviors. Like you said earlier, you're talking about mental health and suicide among different populations. We've had some episodes on the Manifesting Health series to talk specifically about that, but there's all kind of ways that we revisit that. I know I'm going to have a guest on not long from now that's talking specifically about first responders and their health. And so there's another large gap. Not only do you have the male population, but who are disparate in their receiving of care, but now you have a male who cares for others and tends to be frontline, or even those who don't receive care even more so because they feel whether it be invincible, or they don't feel as
Yeah.
vulnerable, or they're so
Yeah.
busy saving and caring for others that they don't think about themselves as
No.
someone that needs to be cared for. But we're going to be really excited to have that guest on soon
Yeah,
comes
I'm
to
excited to hear
first
it.
responder awareness and so forth. So that's going to be an exciting episode. But in our last few minutes we have together, Rebecca, I want to talk about what we can do. We're talking about our collaborative approach, but what can our listeners do to get more and more engaged in this process and help?
Yeah, I mean, absolutely. Learn more about Movember, what we do, what our key strategies are in our years moving ahead. If it's okay, our 5 strategic goals are, like I said, lifting the profile of men's health, strengthening men's health literacy. That touches everything, so that we encourage them to seek help. But then when we do get them to help, we want to make sure that we support them in that, reaching out for help with things that are accessible to them and digestible. Also incorporating gender responsive healthcare for men, making sure that we know how to treat men and some of the disparities that they face. Young men's mental health, too, is one of our strategic goals, and improving prostate cancer and testicular cancer mortality and quality, excuse me, I can say that word, quality of life. And that's where I primarily oversee in the US. So if any of those are of interest to you, I would encourage you to reach out to me. Go on to our website, movember.com, follow us on Instagram, any of our social media pages. And then if you're interested in hearing more about the Real Faces of Men's report that's coming out in fall, like let's amplify this. Let's make sure that we shine a very bright light on the data and the need for men's health nationwide.
Well, thank you again, Rebecca, for being with us. And again, that's Movember.com. We're really excited. And a
November.
special treat that you're going to have for those of you who attend our annual conference in the fall is Rebecca will be there. So we're going to have Rebecca there as one of our keynote speakers. So we're quite excited to have that sharing of information, that sharing of her expertise, but also building that network even more. So, you'll be very thrilled to know we're a very collaborative group during our conferencing. So we're quite excited to have you with us. But again, thank
I'm
you all for
honored.
listening. Thank you again,
Thank
for
you
Rebecca, for
so
joining
much.
us.
Thank
Absolutely.
you.
So thank you all for joining us today, and we look forward to seeing you next time on Manifesting Health Series. Thank you.